tennis elbow has nothing to do with tennis. Hi, I'm Dr. Jennifer Tucker, your host of the Surgeon's Guide to Rider Recovery. And if you are looking for information about that horrible pain on the outside part of your elbow, then you're in the right place. And stay tuned to the end of the video to learn about easy activity changes and products you can use to get rid of your elbow pain. Now, tennis elbow is also called lateral epicondylitis, and it was first described in England back in the late 1700s. You'll love this. It was originally called washerwoman's elbow, and then was described as lawn tennis elbow as that sport gained popularity at the time. These days, it's much more common in people performing repetitive, strenuous movements, and it is certainly not exclusive to tennis. And the term lateral epicondylitis is actually a misnomer, as the main issue is actually micro-tearing of a tendon and not inflammation. To make matters worse, there's no consensus on the best course of treatment. But what we can agree on is that modifying your activity, using a forearm strap and specialized course of physical therapy is a great place to start your treatment. Now, the underlying issue is small tears in the tendons that extend your wrist, and they originate at your lateral epicondyle here. These tears occur in an area with poor blood supply, resulting in a disorganized healing process. It's like trying to build a scaffold with cooked spaghetti noodles. It just isn't strong enough to handle the load and keeps tearing, which is why the pain is persistent. But how do these tears happen to begin with? It's mostly due to repetitive motion, heavy gripping, and forearm rotation, which I'm sure describes your activity every day at the stables. I found an article studying the rate of injuries in German show jumpers, and tennis elbow accounted for 51% of all the tendinopathies reported, regardless of age or experience. This is one of the more common problems I see in my office, so you are definitely not alone. We used to inject steroids as a first-line treatment for this condition, but several years ago, a study came out in the Journal of the American Medical Association, JAMA, that found patients who received steroid injections for tennis elbow had more pain at 1 year than patients that did not get a steroid injection. Because this study completely debunked the standard of care of injections for tennis elbow, other researchers repeated the study and the results held up. The injection can help the tendon heal if it is done a very specific way, and this way is called trephination. This technique of injecting can maximize healing and minimize the chance of your pain returning, but there is no way to guarantee that your pain won't come back. Trephination is multiple tiny pokes of the needle directly into that particular ECRB tendon origin to get blood flow and healing factors into that damaged area. Plenty of patients want immediate relief because tennis elbow pain can be so severe, but there are side effects with steroid injections. The steroid can thin your skin and even cause a loss of pigmentation. If this happens, additional steroid injections can make your skin worse. This is why we try conservative treatment first, limiting and changing how you grip, using a forearm strap, and utilizing physical therapy can help your tendon heal. But how are you supposed to ride and care for your horses if you can't grip? Well, here are a few tips on how to modify your activities. If you can use a wheelbarrow or a cart instead of carrying heavy buckets or loads bales of hay or feed, that will help take the stress and strain off the outside part of your elbow. Use your opposite arm for heavy lifting. Keeping your thumb or palm towards the ceiling when you do have to grip and lift will also help. Now, there's a forearm strap which creates a false insertion point but protects the tendon trying to heal, and that can be very helpful as well. I like the SleeveStars forearm strap, which I've linked below. You'll want to bend your elbow and place it right where your crease ends. This will help take the stress and strain off that segment of tendon that needs to heal. And I found many patients also like compression while they're healing, and I'm often asked to recommend an elbow sleeve. I have received great feedback on products come from a company called Incrediwear. They have performed research on patients with knee arthritis and have shown their products decrease knee joint effusion and maintain mobility. You'll also find studies that show magnets and metalloid infused garments such as copper don't provide any significant benefit with respect to pain relief. So why are they so popular? I think the answer is somewhere between great marketing and the placebo effect, but the compression that they provide can be helpful. If you do decide to invest in an elbow sleeve, I recommend the more compressive version from Incrediwear. There is research to show that compression can help musculoskeletal recovery, particularly when worn after your activity. And I've included the links for all of the products mentioned in this video, as well as the research behind them. If you like what you've heard in this video and are interested in learning more, please hit the like and subscribe button, and please share your comments and feedback, as it really helps me build bigger, better content just for you. Thanks for watching The Surgeon's Guide to Rider Recovery.